My name is Dr. John Thuraraja, and I'm board certified in internal medicine. I'm also board certified in geriatric medicine. And I'm going to talk about the coronavirus, why it's so deadly, and why the case numbers are continuing to go up, and what we have to do to flatten the curve. So what are the 5 reasons why the case numbers are going up? Number 1 reason, it's infectious. It's highly infectious. So how can we infect somebody? We can infect somebody directly or indirectly. How can we infect somebody directly? Through coughing, through sneezing, especially when somebody is in close proximity, and through droplets, we infect somebody else. Indirectly is if we touch certain surfaces, plastic, wood, and we touch it with our hands, and then we inadvertently touch our face. The way the virus gets into our body is through our nose, through our mouth, and also through our eyes. That's why hand washing is that important, and that's why keeping a certain distance, at least 6 feet from somebody else, is just as important. The second reason why the virus is so deadly and why the case numbers continue to go up is the long incubation time. So what does incubation time mean? The incubation time for this virus is around 2 to 14 days, and usually we start seeing symptoms around day 4, day 5, day 6. What are the symptoms? The most common symptoms are fever, cough. It's usually a dry cough, and shortness of breath. We usually get shortness of breath around day 4, day 5, day 6. There also are other symptoms which are not that common. However, some people do have these symptoms, such as headache, sore throat, muscle pain, even GI symptoms as well. Most people, if they do get infected, have mild to moderate symptoms, mild symptoms such as a bad cold, to moderate symptoms all the way to pneumonia, and it is then treated symptomatically at home through rest, water, and if need be, use Tylenol or even ibuprofen to help with symptom management. I think the other thing which is then quite scary is asymptomatic transmission. So there's some people who have hardly any symptoms or no symptoms at all, and they are able to transmit a couple of people, 3, 4, 5, 6 asymptomatically, and these people then can further infect other people as well. The third reason why this virus is so dangerous is there is no innate immunity. That means we do not have an immunity. As we know, this is a new virus. That's why it's called the novel coronavirus, and this was termed by the World Health Organization, the WHO, early February. This is a variation of the SARS virus in the early 2000s, and it was also initially called the coronavirus SARS-2. This is a novel virus. That means this is a virus which is new to us, most likely a zoonotic virus. That means it jumped from animals, or most likely a bat reservoir, to us humans, and because of the novelty of this virus, we don't have immunity. For example, if we compare this to the common flu, we do have flu season on a yearly basis, on a seasonal basis, and we do have an immunity against the flu to a certain degree. However, this virus is completely new. The fourth reason why the case numbers are continuing to go up is we do not have a vaccination, and we do not have any medications to help, or at least medications which are FDA approved. A vaccine will probably take around 12 to 18 months until it's FDA approved and until we can use it on live subjects. And in terms of medications, there are some medications on the market. However, none of them have been FDA approved, nor have they been used on randomized controlled trials. And some of the medications are remdesivir, which had been used in the past against Ebola. Then there is this combination of anti-HIV drugs, which are protease inhibitors, and then there's this other combination of this malaria drug combined with an antibiotic, which is azithromycin, combined with the anti-malaria drug, which is hydroxychloroquine. And the fifth reason why this virus is so dangerous and why the curve continues to go up with the amount of cases is the mortality rate. The mortality rate, especially in older adults, especially above the age of 80, but in particular when you're looking at people in the age groups from 60 to 70, from 70 to 80. Above the age of 80, nearly every fifth person who gets infected has a higher chance of dying. And this is part of the reason is because when you get older, you get more frail, the decreased immune response to antigens and viruses, but also because of people with multiple comorbidities and pre-existing conditions such as diabetes, high blood pressure, cardiovascular disease. And most people who do get infected, around 80%, will end up with mild to moderate symptoms. But however, around 20% will require hospitalization. So around 15 to 20% will require hospitalization. And from that 15 to 20%, 5% will end up in the ICU, in the intensive care unit, requiring their use of a ventilator. And from that 5%, 2% will end up dying in terms of the mortality rate. So how does that translate, for example, to New York State? And this is the state where I live in. New York State has a population of around 20 million. I'm just using round numbers. So if around 50% of the population gets infected, people think around 40 to 70% will get infected throughout the course of this disease. So let's say 50% from 20 million get infected. How much would that be? That would be 10 million people. And if around 5% end up in the ICU, 5% of 10 million is 500,000 people. Obviously, that's a lot of patients who require ICU help. If we just take 2% of that number, that'll translate to 200,000 in the ICU, and we only have around 150,000 ventilators in New York State. So we do not have enough ventilators to take care of the sick people. Moreover, the people who are sick with this disease require a longer hospitalization and also a longer stay in the ICU, using up resources, time, and staff. And usually a hospitalization in the ICU takes around 3 to 4 days. However, because of the severity of this disease, in particular attacking the lung, you stay longer in the ICU, 9, 10, 11 days, not only using up valuable resources, the length of stay is longer in the ICU. So these are all problematic, and this translates to what you see on that dotted line, which we refer to as the hospital threshold capacity or the threshold capacity. Now, the threshold capacity, what does that mean? The threshold capacity translates to all the hospital beds, the ICU beds, the medications, the PPE. So there will be a time when hospital resources continue to be depleted because of all these patients coming into the hospital, and in particular into the ICU. And there will be a time when the curve continues to rise in terms of its trajectory, and that threshold capacity is crossed, and the hospital is overwhelmed and cannot cope with the number of patients and the number of people coming in. So what do we have to do? We have to try to flatten the curve so that the threshold capacity is not crossed, and we can then flatten it and decrease the number of cases going to the hospital. So how can we flatten the curve? So we can flatten the curve to things which we can do on an everyday basis. Wash your hands, wash your hands, wash your hands. Good hand hygiene is important. The other thing which you can do is social distancing, and everybody's heard about social distancing. You need to stay a certain amount of feet, at least 6 feet from the next person, so that you cannot transmit the virus even if you're an asymptomatic carrier. One of the things which I advocate for, especially when the curve is rising, is to test as fast and as early as you can, because when you can test people who are symptomatic, you can take them out of the pool of people, quarantine them, isolate them, and then when they're feeling healthier, they can come back, so to speak, into a society. Now, what are we trying to do to raise the threshold capacity? So we can raise the threshold capacity by increasing the beds in the hospital, by increasing delivery of masks, of PPE, of medications, getting more staff in. There have been movements, especially in New York State, to look for other venues to look after people, makeshift hospitals, U.S. Army ship coming in to the New York harbor. You have makeshift hospital settings in a convention center. So to decrease the burden of the hospital and to decentralize it and to transfer some of the burden to these other makeshift hospitals. And thus we are increasing the threshold capacity of the city, and in particular the New York State hospitals. So other things which are being done to decrease the transmission of the virus. Schools are being closed, malls are being closed, restaurants, pubs, so on and so forth, and only essential workers as we continue this battle against the coronavirus. I hope I could clarify some of the questions regarding the coronavirus, why the cases are going up, or what we have to do to flatten the curve, as well as to increase the threshold capacity of the hospitals. If you enjoyed this video, please like, comment, and subscribe.